David Hertel in for Aaron and Natasha. Well, we're going to stay in the healthcare universe, but this time we'll talk about some good news for once. When I was a member of the National Assembly for 5 years in Saint Michel, one of the great thrills I had all the time was being able to give the Medal of the National Assembly to a deserving citizen who was involved in his or her community. And yesterday, a familiar voice on CJAD received that honor. You know her very well. She is Julie Quenneville, President and CEO of the MUHC Foundation, and she joins us now. Julie, thank you very much for joining us, and congratulations.
Hi, David. Thank you so much. Thanks for the invitation and for the incredible support that you've given us. And what an incredible evening that was yesterday. I feel even today I feel incredibly emotional about it.
So tell me more about that. How did you learn about that? How did all this come about?
Right before my vacation, I received a call from my M&A, Monsef Daraji, to let me know that he had nominated me and that I had been accepted, and I was absolutely blown away. And on top of that, to be invited to sign the Book of Kirkland, where I have lived most of my life. The city has transformed immensely since I first moved there when I was about 8 years old. But it's incredibly emotional to celebrate these moments with the people who've been so close to me throughout my life.
Julie, I understand this was awarded for your commitment to philanthropy, changing lives, and medicine by investing in medical research. I mean, you're not done. I mean, this is not a lifetime achievement award. That's it. So, I mean, at this point, the recognition and the work you've been doing, you and your team at the MUHC Foundation, has been huge. We hear about it with Tara Schwartz. You hosted the show prior to Tara on Sundays. It's amazing what you guys do over there. Tell me what's happening right now at the MUHC Foundation. What are you working on? What are the priorities? What recent accomplishments you could talk to us about?
Well, first of all, David, there's a million things I still haven't done, so I'm just getting started.
That's what I think.
I'm really lucky. I have the best job in the world. I'm surrounded by the most incredible people day in and day out, researchers, physicians who are coming up with cures to disease, and the leaders in our community who are there to help them and to support them and want to invest in advancing medicine in our city right here in Montreal. Mm-hmm. And so what we're working on now are a couple of really major transformative projects because, as an academic hospital, the contribution that we have is really about advancing medicine. That physicians in general apply and implement the medical books that they have learned. And our job is at the MUHC is to actually change those medical books. And the foundation's role in that is to fund the innovation portion of it, because a researcher actually can't even apply for a research grant until they have proven that the research already works. And how do they do that without funding? So we come in and we inject seed funding, and every dollar that the community puts in, because it's not us, it's the community's investment, gets leverage for $4 to $20, depending on the project. So we're working on infectious and immune diseases and building the first institute for infection and immunity with McGill University, a wonderful project. And we have a number of amazing projects in cancer and cardiovascular and respiratory. So it's very exciting.
Speaking with the president and CEO of the MUHC Foundation, Julie Quenneville. So, Julie, I cannot have you on without talking about COVID and what's going on right now and the numbers. I'm wondering, throughout the pandemic, we're in year 3. The government just gave us an update earlier this afternoon. Things are not heading in the right direction. What is the foundation's role, or what have you been doing with regards to the pandemic and COVID-19?
Yeah, so the foundation, actually, the pandemic really proved the need for philanthropy, David. If we kind of take a step back, when the pandemic hit, we had already begun to invest in building this Institute for Infection and Immunity that I just mentioned. So we've made a commitment with McGill to invest each $60 million into building this. And the pandemic was the first test of what we had already started building. We had discovered that we had the largest consortium in the world of researchers in this area already right here in Montreal, and we've started to bring them together and build research infrastructure for them. And so at the start of the pandemic, a number of incredible families in this city and hundreds of donors contributed to be able to take what we'd already built, this infrastructure, and call upon the research community for immediate solutions. So we published our first call for solutions in March of 2020. The federal government didn't do that until months later. And then we called for solutions to vaccine hesitancy, which we saw months before that came out. And what that really meant for Montrealers, because that's what we want to think about. What does that mean for patients? It means that absolutely every patient that came into the MUHC throughout the pandemic was offered one of the many medications that we believed could be efficient against COVID. If you came to another hospital, a community hospital without this infrastructure, you were offered, a ventilator and hope and prayers. But there were a number of medications that Donald Trump named quite a few of them, as you recall. But because we had this infrastructure and we had the researchers, we were able to be one of the top recruiters of all patients for clinical trials in Canada, right here at the MUHC. That's the difference, and that's why we need to have an academic hospital like this in our city.
Part of your career, I know this, is you were in politics as well. You worked on Philippe Couillard's staff when he was health minister. I mean, it's always interesting to get the perspective of someone that was in government. How are we doing in terms of the healthcare system? I don't want you to get political, of course, but I want your eyes on this because you've been involved in different roles with the healthcare system for so long now. And we're seeing these numbers. We're seeing the healthcare system, especially in Quebec. We have the least number of beds per capita in the G7. Yep. We have enormous tasks today. I mean, it's as much as about the virus as it is the fragility of our healthcare system. So I really would enjoy having your perspective on the situation and where we should be heading.
And don't forget that we have one of the highest percentages of hospitalization of our seniors as well.
Yes.
Right. And
we send our seniors to the emergency room instead of developing senior care.
Exactly. With a complete lack of home care. So a lot of what we're seeing today are some of the same themes that we saw when I was in government. But what has happened, and it's not one government, I'm not going to blame one, because numerous governments have
We'll
had
take
this
all the blame.
issue.
Don't worry. No, they all can take the blame.
The number one problem in the healthcare industry right now is manpower. We could open all of these beds. We could open more surgical time, but we don't have the manpower. So you take COVID, we have a situation where we have forced retirement of an entire layer of managers. We've had a significant amount of retirements because of COVID, and every time there is another COVID wave, which we are facing right now, people have to isolate every time they are in contact or have COVID. And then we have vacations. And so the risk right now is the lack of people. The foundation is now funding in a number of different sectors scholarships to incite students to go into a variety of different healthcare trades. But we need to do so much more, and we need to invest in healthcare. I hope, David, that what we have learned the most throughout this pandemic is that when our community is sick, absolutely nothing else matters. And we need to invest in our healthcare. Yes, it is the number one expense in the Quebec government's budget, but it is so important to our ability to drive the economy and to protect our seniors and to protect our children. We have to invest strategically, and we have to invest in more prevention in order to prevent a lot of these diseases. What I predict, and many people have predicted already, is during the pandemic, we reduced, unfortunately, access to diagnostics, and we are already seeing much more advanced cancers, much more advanced cardiovascular disease. And so these are the big risks. We need to get people diagnosed early and treated early so that it's much easier and we can send them back to their families and to their jobs.
Julie Quenneville, thank you so much. Congratulations on the National Assembly Medal. Great award. You totally deserve it. And thank you for all your hard work, and please keep it up.
Thank you so much, David.